I would recommend the Physician Associate course to anyone who is interested in working in healthcare. I'm really enjoying the course at BSMS, and what I enjoy most is the case-based learning that we get every week. I also enjoy the small group discussions that we have in the class.
I'm really enjoying my second year at university because we're doing mostly placements. This means that we get to go to loads of different areas in hospitals and in primary care and get to see a really wide range of patients in clinical settings.
So I think the most important factor somebody needs to consider when they're looking at where to study to become a PA is the quality of the course and the quality of the learning environment. We've been top twice in the last 3 years in the National Student Survey for our medical students, and I'm confident we can do exactly the same for our PAs.
The quality of teaching at BSMS is excellent. We've got a really good mix of young doctors straight from the wards and experienced clinicians, including some experts from their own field. The week is great because it's really varied. On a Monday we have lectures, on a Tuesday we have labs in the anatomy dissection room, and on Wednesdays we've got practical clinical examinations, and on Thursdays we get to go into clinical placements, which is great early experience, and on Fridays we all present to each other. Going into general practice from week 3 of the course was initially daunting, but it meant we could all put into practice what we were learning in the classroom from a really early stage and practice on real patients.
So I'm really enjoying my second year at BSMS studying to become a physician associate. I think the thing I'm enjoying most is actually being out in clinical practice and being able to kind of use the clinical skills I've learned and show everyone what I can do.
Most recently I did my paediatrics placement, which was really fun. Got to see lots of different areas within paediatrics, and the kids are adorable.
So I think one of the most exciting things for PA graduates is how quickly they can get into a defined clinical role with a degree of independence and autonomy that would be unheard of for medical and nursing graduates.
I think the future is very bright for PAs because the modern NHS has to really diversify in the way it recruits staff.
And I think our local trust is actually really looking forward to developing the role of the PA.
The prospects of being employed locally is very good. I think the PAs will be snapped up, not just by BSUH, but across the patch by other secondary care providers in acute situations and also by primary care and community providers.
I've really enjoyed living in Brighton. I didn't know anyone before I came here. It's turned out to be a really vibrant, colourful city, and I've made lots of friends through the course and through living in the centre of town. Living by the sea is great as well, and the music scene's great too.
I would definitely recommend the Physician Associate course to anyone who would like to work in a healthcare setting. You get a choice to work either in a GP or in a hospital, and there are different roles you can get yourself involved in.
I think if you're interested in becoming a physician associate, BSMS is a really great place to learn. The faculty have been really supportive, really fantastic teaching. The placements have all been really accommodating, and it's been a really positive experience overall.